Alrighty, good evening, everybody. Welcome to the Respiratory Therapy Creating Opportunities for Our Future webinar hosted by the American Association for Respiratory Care, or AARC for short. HOSA is honored to be partnering with AARC to provide HOSA members and advisors with tools regarding the respiratory care profession. My name is Ria Mohan, and I currently have the honor of serving as the International President-elect of HOSA. My HOSA journey started 6 years ago in Seattle, Washington, and now I currently am a sophomore at Virginia Commonwealth University, majoring in forensics on the pre-med track. As an aspiring physician, I could speak forever about how HOSA has prepared me very well for a healthcare profession, much like the respiratory care profession. So without further ado, I have the pleasure of introducing our presenter tonight, Terry Miller, who serves as the chair of the Department of Respiratory Therapy and Health Sciences at Middle Georgia State University. Terry is a registered respiratory therapist, a certified pulmonary function technologist, and a huge supporter and advocate for HOSA-Future health professionals. During the session tonight, you can send any questions through the Q&A feature, which is at the bottom of your screen, and the session will be recorded and shared with you afterward. We are super excited to learn more about respiratory therapy from Terry. Thank you so much for being here.
Thank you so much, Ria. I'm really excited to be here, and I thank you for this opportunity to share about our profession and to share about our collaboration with HOSA. We're very thankful for that opportunity. I do serve as the HOSA liaison for the American Association for Respiratory Care, and as we go through this presentation, some of these slides that you see like right now with the BNRT on there, these are part of a PowerPoint presentation that's available for some of the HOSA advisors to use in classrooms. I know today that we have some of HOSA advisors that are joining us, as well as some of the HOSA members who are part. And for some reason, my screen is not advancing when I'm wanting it to. Let's see, there we go. All right, so as we think about this presentation, I would like to disclose that I do not have any conflicts of interest. However, as Ria mentioned, I do serve as the chair of the Department of Respiratory Therapy and Health Sciences. I also serve as the Vice President of Internal Affairs for the American Association for Respiratory Care. And most significantly, I serve as the chair for the AARC's Workforce Recovery Task Force. And that's what brought me here today with you. As a chair of that committee for the AARC, one of the things we are looking at as a profession is we don't have enough respiratory therapists. We've had an increased demand. There needs to be more RTs out there to care for our patients. And so that's one of the things I was tasked with by our board is to let's see what we could do. And this partnership with HOSA has been one of the initiatives that we have started to try and promote and share our profession. A lot of people don't know what it means to be an RT. I recently, actually just last week, had about 130 HOSA students come visit our campus. And I started the conversation by saying, who knows what a respiratory therapist is? And not many hands went up. And I asked them if, how many of you know someone that has lung disease? And not many hands went up. But when I asked things like, do you know someone with asthma? Do you know someone with COPD? Do you know someone who has sleep apnea and wears CPAP at night? Do you know someone who had a premature baby that was delivered and needed to be on oxygen or a ventilator? A lot of hands went up. And so chances are, sometime in your life, you've been around a respiratory therapist or someone you know has been cared for by a respiratory therapist. And so I'm excited to share a little bit more about our profession. My objectives here, I know that we have some of the HOSA members on, and hopefully we have some of the HOSA advisors on, but also there may be some respiratory therapists who have jumped on here with us too. And so we're going to share a little bit about respiratory therapy. We're going to look at how, some strategies for, doing some of the RT competitions, and also some of the resources that can be used in our communities to help support these experiences. So I'll just jump in here right now and just share. This is one of those slides I was telling you about what is a respiratory therapist. We are a specialty career in healthcare. And that was one of the reasons I chose it. I wanted to specialize in a specific area. And as I mentioned earlier, some of those disease processes that we deal with and those patients we care for, they do need the care of a respiratory therapist, because when you think about breathing, if you have a hard time breathing, a lot of the other stuff doesn't matter. And so respiratory therapists care for patients during some of the most vulnerable times of life. From an example there on the screen of a premature baby, respiratory therapists in high-risk deliveries are the ones they hand that baby off to help with their breathing and to make sure that they're doing well and intervening if they need to. And there's one of my former students, one of my alumni there, doing some airway management. So caring for premature babies is an example of that. Our respiratory therapists care for patients with pulmonary and breathing problems. And so when you think about where do respiratory therapists work, we work primarily in hospitals, mostly in intensive care units, neonatal, pediatric, and adult ICUs. That's where the majority of RTs work, but we work in ERs. Some might even be in OR. We work in home care companies that provide oxygen and some of the different modalities that our patients need, sleep labs, education programs, doctors' offices, even case managers. Respiratory therapists can be case managers specifically for those patients that have pulmonary problems. So we have respiratory therapists who do flight transport, transport in ambulances, and works with patients in pulmonary rehabilitation programs. So there's a lot of opportunities and niche areas for respiratory therapists to work in. As you think about exploring a career in respiratory therapy, some of our advisors, if you're looking to share with your students about opportunities there might be, I know more and more there's so much pressure on our students to choose a career early on, even middle school, high school, and pursue it forward. And so knowing what opportunities are out there has never been more important. And I'm excited to share that the respiratory therapy profession is growing. There's lots of opportunity and it's going in the right direction. In our U.S. Bureau of Labor Statistics, we're just shy of 134,000 respiratory therapists in the U.S. And our median annual salary has gone up to just under 78,000. But I will point out that's the median salary. I had one of my alumni just say last week when they saw this slide, they said, I just graduated and I made a lot more than that my first year out. So there's opportunity, it's good pay. Most of them work in hospitals and med-surg areas. In most of those big hospitals they work in are in urban areas, but respiratory therapists are needed in our rural hospitals as well. One of the best career opportunities I did was actually serving in a small hospital, and I learned how to be a better therapist working in those smaller hospitals. As you look at this, there is a need for respiratory therapists. There is a 13% growth anticipated for the profession as far as need, and that is faster than the average. And so what that means is there's going to be jobs out there for you. So as we look at what does a day in the life of a respiratory therapist look like, a lot of this is going to depend on what areas they work in, and it can be very specific. But what we do, we work hand in hand with doctors, nurses, other healthcare professionals to assure that patients have the care they need for their pulmonary problems. We do a patient assessment. We communicate with physicians. We draw arterial blood gases. We put in arterial lines. Some therapists even assist with chest tubes and assist physicians with putting in tracheostomies and doing bronchoscopies. We manage mechanical ventilators. We heard a lot during COVID about patients being on ventilators. Well, guess what? Respiratory therapists are the ones who manage the majority of mechanical ventilators out there in all of our ICUs. They're those ones who help put in those airways to help breathe for the patients. We serve on rapid response teams when patients are having distress. And we do a lot of education in our community. One of the interesting things about respiratory therapy I didn't even think about until relatively recently is that we're kind of unique in the fact that when students are in our respiratory therapy programs, they do the majority of their training in critical care areas. That's different than nursing or some of these other healthcare career choices because they need to be trained in neonatal, pediatric, and adult critical care while they are in the program so that they can intervene and do things like intubation and mechanical ventilation, hemodynamic monitoring, and applying all those things and caring for patients. When respiratory therapy students graduate, they are held certifications in advanced cardiac life support, pediatric advanced life support, and neonatal resuscitation. So they're very flexible in the different areas and the patients that they can care for. The U.S. News and World Report ranks respiratory therapy as the number 12 in best healthcare jobs. And that number is up just over the past year. So I was really excited to see this update. And I have to agree, I think we're on that rise. They report a good job satisfaction. A lot of it's about flexibility. When I think about being a respiratory therapist, one of those things I've always enjoyed was we get to do some of kind of those exciting things in healthcare and being able to go from, a critical patient here to patient education. It's never a dull moment, so to speak. And so that's one of the things I've always enjoyed. But work-life balance is also an important piece of this. And so those opportunities of where you work, there can be good work-life balance in scheduling. And best of all, there's advancement opportunities that are just continuing to grow. Here you can see some of my alumni. They're doing some mechanical ventilation and airway management in our laboratory and then doing some of their training. So how do you become a respiratory therapist? I'm going to share a little bit about this here, and I'll share a little bit more as we go through. But first of all, I would encourage you to do some exploration on some really wonderful websites. We have one website that's hosted by the American Association for Respiratory Care called bnrt.org, and I'll have a QR code a little bit later on that allows you to go straight to that. Also, there's another website called morerts.com. The BNRT website has all the information about what a respiratory therapist is, what we do, who we care for, how to become a respiratory therapist. And More RTs is more of that personal connection that shares the stories of actual respiratory therapists who tell about what it is to be an RT. As far as degrees, there are associate's degrees, baccalaureate degrees, and master's degrees in respiratory therapy. All respiratory therapy entry-level programs train respiratory therapists to the same objectives. And so when respiratory therapy students graduate, they take credentialing exams to become a registered respiratory therapist. And that's always the goal. And so when they become a registered respiratory therapist, they out there and they can apply for licensure. 49 of our 50 states have licensure for a respiratory therapist. So this guarantees a quality standard in assuring that our patients are cared for. Also, as you think about finding those niche areas where respiratory therapists want to work, specialty credentials exist. So neonatal pediatric specialist, adult critical care specialist, asthma education certification, certified and registered pulmonary function technologist, and coming soon, advanced practice respiratory therapy credentialing. We do have a few advanced practice respiratory therapy programs in the US, and the VA system just hired the first advanced practice respiratory therapist. So when you think about going to that next level in caring for patients, we're on that track. Lots of opportunity ahead. And so advancement there is a lot of opportunities to grow within the profession. So our different professional organizations, we call it the Respiratory Collaborative because we work together to assure that respiratory therapy is a profession that is cares for patients at a quality standard, and that's really important to us. As I mentioned before, when patients have problems breathing, not much else matters. And so when you think about the different organizations that help us get there, the American Association for Respiratory Care is our volunteer association, and that's that professional organization who helps provide education, who advocates for respiratory therapists, but also for some of our patients in respiratory therapy. When we go to Congress and say, okay, we need to change these laws about patients having access to oxygen, well, it's the AARC that helps do that. We also have the National Board for Respiratory Care, which is the credentialing body that helps assure that respiratory therapists meet the standard to care for patients. And then the Commission on Accreditation for Respiratory Care is our accrediting body that assures that all respiratory therapy programs in the U.S. meet the standard to graduate quality respiratory therapists who are prepared to take those credentialing exams and demonstrate competencies to care for patients. Now, I do want to take a minute to share a little bit about the structure of the American Association for Respiratory Care because this is relevant to you. The AARC has an executive office, just as HOSA does, that provides the website, that does the guidance, and meets those national level needs. It has a board of directors that helps guide and direct what we do as a profession. But also, just like HOSA, the AARC has state affiliates, and we have a House of Delegates that represents our members at the national levels. And just as HOSA does, we have affiliates who do things and have meetings in their states and help guide that local, just like HOSA. So as we think about those members for HOSA and for respiratory therapy, we have three levels: national, state, and local. And that's how we've worked really hard to make sure that we are partnering with HOSA in such a way that you have connection and you have what you need to explore our profession. So, just as a summary, our profession, we are expanding our roles, we're expanding our credentials, we're expanding our degrees, and guess what? We have more demand than we ever have before. So in looking at that partnership we've developed with HOSA, I mentioned those different levels and how we structure that. And that's how, for our advisors that are on the call, that's how we have rolled out our approach to sharing about our profession and getting involved with competitions. AARC has made the commitment to be a premier sponsor for HOSA, and we are following that up with things like scholarships, things like being engaged in the international leadership conferences, and also trying to roll this out among our states. Our state affiliates in the AARC are highly committed to connecting locally with our HOSA groups. The House of Delegates will actually start providing names of primary contacts that will be your HOSA liaisons within the state. And those should be coming out here in the next couple of months. And so you'll have that person that you can contact if you need to connect with RTs. We also are encouraging regional connection with our respiratory therapy programs. We have respiratory therapy programs in most states, and those programs we've shared with them about our partnership. They've been provided toolkits and resources to be able to connect locally with our HOSA groups. And we know how HOSA loves competitions. And so that was one of the first things we did in 2023 is start developing our respiratory therapy competitions. And I was so excited to see our first national competitions in Houston this past summer. And it was so exciting to see 40 students were there to compete and to see those recipients of the Respiratory Therapy Awards. I'm really excited about it. So I wanted to make sure that you are aware that our message to our respiratory therapy members in the AARC, and in fact to all respiratory therapists, have been, it is our goal for respiratory therapists to connect with our HOSA chapters here across the US and worldwide. Also to make opportunities happen that respiratory therapists need to be available to visit HOSA classrooms and share resources, that we need for our respiratory therapy programs, that we host visiting HOSA groups to come into our campus is for some show and tell, that we attend state and local conferences and serve as exhibitors and host workshops about respiratory therapy. And in fact, the AARC has put money towards our state affiliates to help support that connection. So we're really working hard to make sure you have that resource you need. Our volunteers are committed to serve as mentors and also to help with serving as judges. Our message for HOSA is that there's an opportunity. And I just want to take a minute to share from my perspectives why I think respiratory therapy is a perfect fit for HOSA students to explore as a career option, but also just in general about what respiratory therapy is. Because respiratory therapy is an evidence-based practice. We're a career where you apply that science that you learn. It's very chemistry and physics focused. We use a lot of math in how we manage our mechanical ventilators. And so you can see there's a lot of technology that's involved with it as well. So when you think about STEM foundations for our HOSA advisors, respiratory therapy is a good example of applying some of those principles. It's also very important in any healthcare career to have good, strong communication, to be compassionate caregivers, and also to apply that critical thinking. And I think respiratory therapy does a wonderful job of that. I wanted to give one example. When I was a student, and it was high school, quite some time ago, we did an experiment in my physics class, and it was where our instructor laid a speaker on its side and played a old LP back in the day. And what we did is adjust the amplitude and the hertz and the volume of that music, and we put a plate of rice on top of it. And what we did is as we increased the amplitude, you could see how that rice bumped up higher. And then as we increased the hertz, we saw how it bumped up faster. And so we could see the effect of sound waves. Guess what? How much impactful would it have been if I had known that one day I would ventilate a premature baby that I could hold in my hand, just the size of my hand, and help save them through using sound waves for ventilation? To me, that's one of the coolest things we do, is we apply those physical principles in caring for patients. So those little lungs that are premature and can't handle those big volumes and large volumes, we can ventilate them with breaths that go in 100 times a minute, and really fast breaths. That's how cool respiratory therapy is. So our message for HOSA, we want you to share about our profession. We want you to share about pulmonary patients because lung health is important. And we want you to help prepare our future. So we're excited. Let's do this. For our HOSA students out there thinking about doing an RT competition, let's do this. I want to see you. Get out there and get busy and compete in some respiratory therapy competitions. Our resources that we've provided with the AARC, we have developed a website, and I'm really thankful for our AARC team who's gotten in there and made these resources available. We have an all things HOSA site. It's for advisors. There's some tools for advisors. There's tools for HOSA members. There's tools for respiratory therapists that might be trying to connect with HOSA, our affiliates, both for HOSA and the AARC. We have a toolkit that's out there for our affiliates, but also for HOSA advisors to be able to access resources they may need. This is one thing that's really important to me. As we think about teaching in our classrooms about healthcare related topics. Lung health is really important. Making sure that we know things that help us live healthier, better lives is really important. And the role of the respiratory therapist in the populations we serve, we need to be sharing good, strong information about that role of the RT. So some of these resources can be very helpful, downloaded and put to use in the classroom. We have videos, we have a lot of resources there. If you have any questions or any challenges trying to find those opportunities, you can always send a message to marketing@aarc.org and they'll help connect you. As I said, we want to connect respiratory therapists in our local level with those who have a need. So making that connection really does make a difference. So things we want opportunities to do, what we want to see, we want opportunities to share with HOSA students about lung health. Might have students who don't want to become a respiratory therapist, but knowing about lung health is really important. We want to show how you can apply some of those STEM content. Sometimes it's just about trying something new and something different. Or maybe your goal is to be a physician one day as Mia and sorry, it was Ria. And if you want to be a physician, guess who you work with and guess how you can build some of those critical thinking skills. Yes, patient assessment. That's one of the things we do. Sometimes you might want to specialize in an area of healthcare career. That's one of the things I enjoy. And you know what? If you want to work with babies, in transport, we've got you there. Respiratory therapists work with premature infants on up to our geriatric patients. And so working with the babies, that's one of the areas that my students particularly love doing. We want to open doors for future healthcare careers. And as I tell my students, the first day they start in our respiratory therapy program, I'm training them to one day care for me. And really, that's what it comes down to. We're building that future generation who will care for patients during the most vulnerable times of their lives. So as you look here, you can see some of the resources that are available in the toolkit, resources that have QR codes that take to websites, little cards that can be handed out, and information sheets that can be shared with others. And so what does national connection look like? Well, the AARC the past 2 years has attended the ILC as an exhibitor and as a workshop and hosting workshops. And this past year, we gave out scholarships and we're looking at all kind of opportunities to continue that on and to expand it. I will tell you, for all of you who are HOSA members who do what you do, y'all are just awesome. I think the world of our HOSA students, and for you advisors who are out there helping do what you do, it is such a great thing. Now, but you might be asking yourself, okay, well, that sounds all fine and good. The AARC is up there for the national level and they're going to be out there at the ILC. What about my states and my local level and when I need to be doing stuff in the classroom? Well, here are some photos of what local HOSA engagement looks like. I told you our RTs across the U.S. have been shared. We've shared with them what we're doing. They've engaged, and what we're seeing is respiratory therapists connecting at the local level like never before with HOSA. They are attending state conferences and attending as exhibitors and offering workshops. They are inviting HOSA students to respiratory therapy classrooms to explore what being an RT is. They're visiting classrooms. They're taking their pig lungs in to look at pulmonary health. We're making that connection. And here's just a few views of what that looks like. Up there in the top right, you see that fella in the center. That's our current president, Mr. Carl Hinkson. He's a respiratory therapist and he's out there meeting HOSA students as well. We're committed. We want to see what we can do. So some of those important websites I shared with you, BNRT, morerts.com. Also, the American Association for Respiratory Care on its main website, of course, you can search for HOSA. Lots of information will come up. And there's also some career information in there as well. And if you're looking for accredited respiratory therapy programs, COARC has that. And I'm going to show you the easy way to find that in just a minute. So we know HOSA loves competitions. And so that was one of the first things we wanted to start to do. And for my HOSA members, I hope you'll bear with me for a few minutes as I talk to some of your advisors so that they can help support you. But with the HOSA competitions, they are designed in collaboration with RT educators and with HOSA leadership. We decided to do something a little unique. And for respiratory therapy, as I mentioned earlier, sometimes people don't know what respiratory therapists do. And so that was important. Rather than going to taking a test on round one, we felt it was important to make sure we were able to share about what we are as a profession. And so we decided to change things up a little bit. And so that's reflected in how we do it. We also realized that we needed to start small and grow larger. So we started with some very simple skills that are out there for that we as respiratory therapists do, and that use tools that are readily available in the classroom. For our HOSA advisors, most of the equipment we use with our first 7 skills that we started with are available probably already in your classroom, but not very expensive to purchase. There in the bottom right, you can see where I went to Washington when we rolled out our competitions and demonstrated some of the tools. A mannequin that can be used, not even a baby that is a full mannequin, but you can use one just from a dollar store to do some of the initial steps of resuscitation. Nebulizers, we can buy those in pharmacies, over the counter. Pulse oximeters, oh man, we can buy those relatively inexpensively over the counter these days. So most of that equipment you can do and apply without much cost. And the reason we started this way is that so you could be connecting with your local RTs in your local RT schools or your local RT hospitals departments to get access to some of that equipment that may be on the horizon. So when we start going toward more advanced competition, then you'll have access to use some of those mannequins for intubation and even looking at mechanical ventilation and what that looks like. So we plan to expand over time. But the good news is that for the coming year, everything is the same as it was. We're continuing on with those competitions as they were. So if you look at HOSA's website under their competitions, you can find respiratory therapy. You can see it there on the bottom left. And if you click on it, then it opens up the guidelines for respiratory therapy. And this is one of the things I think is really cool about the HOSA team that has made it really easy for advisors and for students by building in these links that take you to these resources. They take you to COARC's resource. They take you to the American Association for Respiratory Care. They take you to those things that will help you get what you need and to know exactly what you need to prepare for competitions. And so even if you don't have a student competing, it might be a great place to go to connect into some of those resources that you can share in your classroom. They're available for students, advisors, and for respiratory therapists. And one of the things I particularly like is that HOSA's site in these links tied directly back to the American Association for Respiratory Care. And we provide some resources that I think are very helpful. One of the things we wanted to do is for round 2, we have those clinical skills I mentioned. Our respiratory therapy students helped develop videos of each one of those 7 skills. I'm really thankful for my team here at the university because they worked with our students to prepare those videos that align with those guidelines to help guide and direct what it looks like to do the competitions. And so some of them are narrated, and then they also have unnarrated. So you have choices on whether you just want to visualize or you want to hear it taught through. That's on our AARC website, and that's there for you. So round 1 in competitions. As I mentioned, we wanted to explore the career of respiratory therapy. So what we want you to do is find a respiratory therapist. We want you to interview the RT, and we want you to develop a presentation. Excuse me. And so how does a respiratory therapist play a role with? And you have 3 topics you can choose from. Excuse me, one second. Asthma disease management, COPD disease management, and smoking cessation. Choosing one of those topics can help inform not only about lung health, but also about the role of the respiratory therapist. I want you to learn about the career, do exploration, use some of those resources that are provided, and then connect and develop that presentation. Like never before, we have ways to reach across through Zoom, through in-person interviews, through telephone. Use some of those opportunities to connect locally. This past year, I talked with several HOSA members who were thinking about doing RT competitions, and they interviewed me to learn more, and that was really exciting. And I think RTs like to share about it, about what it is to be an RT. So round one, 8-minute presentation. Extra pointers for being original. Make sure you include career opportunities, educational pathways, and an overview of the profession. You want to focus on one of those 3 topics I mentioned earlier. And there's rubrics and also example resources out there that are provided for you. Feedback from our 2024 ILC judges was, for round 1, is the importance of practice. And I will say this too, not waiting to the last minute, preparing, doing those interviews in advance, researching the topic, preparing your presentation, and then practice, not just by yourself, but presenting to your class or presenting at the school in some way, getting out in front of individuals so that you're well practiced, so it's a smooth presentation. That was the advice that they wanted me to pass on to you. Practice, practice, practice. And so we're really excited to see Powered for People for the coming year. So skills 2, round 2, are clinical based or skills based. So here we see a list of the different opportunities. Basic airway management. And respiratory therapists, we do a lot of advanced airway management, but the basic airway management, you should be able to do with some of the tools you have. Skills 2 is donning and removing transmission isolation garments. This one I think runs across several of the different HOSA groups. Skills 3, administered oxygen by nasal cannula. A lot of our patients require oxygen, so being able to carefully place oxygen on a patient and then assess with pulse oximetry to make sure that the patient has enough oxygen is a skill respiratory therapists do. And it's so important. And also, you might even see this in the community or in home care or being done for patients or family members. Assessing the newborn, using an APGAR score to do those initial assessments for newborns. Vital signs, that runs across several different ones. And also the handheld nebulizers delivers medications to the lungs. The lungs are a beautiful transmitter of certain medications that get into the bloodstream and help patients breathe. And so nebulizers, they're easily affordable. They can be purchased from pharmacies and different places so that you can relatively inexpensive prepare for some of these competitions. And also connecting with some of our resources in our community might also get you access to some of that equipment as well. So some round 2 considerations. As I mentioned, we started basics. We provided the videos, and also HOSA provides equipment lists and sample scenarios. So a lot of times in the competition, these different areas are combined into the different scenarios. Another piece is if you're an advisor and you're working with the state leadership, go ahead and get your judges connected up. Respiratory therapists are great judges for RT competitions. If you have a need, if there's something out there that's not working, if there's something out there that you need, let us know. We want to meet those needs for you. And so at ILC this past year on round 2 competition, these are some of the competitors. We were really pumped. Our profession is really pumped about this opportunity, and we want to see more of it. We had 40 compete this year. 10 of them were award winners. And so it was really a prideful moment for me, for our profession, to see respiratory therapy up there at the award ceremony and to see a respiratory therapist up there helping to give out the awards. We want to support and encourage that RT connection, and we're here to help and support you. On this next slide, right there in the center, you'll see an example of posters that are being made available to every HOSA classroom. If you're a HOSA advisor, I hope you will put these posters up. Helping the world breathe is kind of like the motto for respiratory therapists. That's what our AARC message is. And as you can see, we do mechanical ventilation, we do airway management, we do critical care transport. We want you to explore. And there it has a QR code where folks can go in and explore. So please share those posters. It's something we wanted to make sure that to help meet that need. Also, here are some QR codes that link to our AARC HOSA information. And also on your HOSA website, that respiratory therapy resource out there for you. So my message for you, HOSA, is let's do this. Henry Ford said, if everyone is moving forward together, then success takes care of itself. We want your success. We're partners with you. We want to make that difference with you and share about our profession, but also to help prepare you for your career goals. We have something for you. And if there's anything I can do to help and support, please let me know. There's my personal, work email, and also that contact with the AARC. If there's some resources or something you need, we'll work to try and connect you with what you need. So let's do this. And with that, I'll open this up for questions.
Hi, Terry, you have access to the questions and answers, right? You can see them?
I'd have to stop sharing. So let me see. No, I do not at this time have access to it. So let me stop sharing and then I might can see something. I could not see anything while I was presenting. So let me look up here. I see chat, but I don't see Q&A. So you may have to ask those questions for me.
So how about if I ask them and you can answer them?
Okay, sounds good to me.
There's 3 of them right now. How would we go to get to the classes to get better to possibly get an RT job? Or probably what classes would they need to get an RT job?
Gotcha. All right. So if you're thinking about wanting to become a respiratory therapist, there are a number of RT programs out there. A curriculum for respiratory therapy usually requires anatomy and physiology, 1, 2, a microbiology. It requires there's usually a chemistry in there somewhere. Of course, your core English is and your regular core towards your degree. Again, a career associate's degree versus a baccalaureate, there's going to be a difference in the core. The training, once you become get accepted to a respiratory therapy program, is then going to you'll be immersed in all RT programs. Once you come into the program, you go through the program and the training as a cohort and graduate as a cohort, and you get clinical experiences. So if you're in high school and you're thinking about what classes that you want to do, I would encourage you to take those STEM heavy courses where you build up your sciences and your math skills and go that direction. But with that being said, we can always work on that when you get to college too. So a lot of opportunities.
Awesome. Thank you. Okay. As you know, we're using the question and answers. So if you have any questions, please type it in the question and answers, and we'll answer as many as we can. The next one is, are these opportunities available in Canada?
Yes, and I can't speak. I can't speak extensively on with about Canada because I don't know all of the ins and outs, but there is a Canadian Society for Respiratory Care. There is an association for respiratory therapy there. And so yes, respiratory therapists do exist in Canada, and they have a very vigorous group that works there. So these competitions, these skills that you would do here should easily translate over to Canadian. I hope that answers your question.
Okay. How can we meet at RT, our respiratory therapist?
Okay, so in order to meet a respiratory therapist, they're going to be in your local areas, in your hospitals, in your RT programs locally. One of the things I would recommend you do is touch base with your advisors. There might be opportunities to invite a local RT to your classroom. That might be a possibility. But if you're needing to connect with an RT in your local area, you can reach out to the AARC. We can connect you with some of the RTs in your region. We have members throughout the U.S., and we would work hard to try and connect you locally with someone who's willing to work with you and get connected.
Awesome, thank you. Another one, I'm interviewing for RT tomorrow. What types of questions should I ask her?
Okay, so you're interviewing to go into a respiratory therapy program is what I'm taking that to mean. So what I would tell you to be prepared to as far as searching for answering questions for an interview, which, by the way, I've been there. I understand how that feels. What I would say is just be prepared to be yourself. One of the things I always consider most important in students coming into our respiratory therapy program, there's the GPA, there's the courses they've taken, there's all of that academic stuff. But at the end of the day, one of the things that I think is really important is you want to care for others and make a difference. And, while you're in the program, that's about training how to do those things. But having a desire to make a difference, I think that's a really important thing. I'd be prepared to say why you want to be a respiratory therapist, or to answer some of those questions about what do you know about respiratory therapy, or how do you see yourself in 5 years? I think that those are all things that help, prepare you for that. Why did you decide you wanted to pursue a career in respiratory therapy? That's a common one you'll probably should be prepared to answer.
Okay, awesome.
Oh, and I just thought about this one too.
Yep.
Be prepared to share about how you handle stress, how you deal with difficult interactions or difficult individuals. Those are things about people skills. And I think HOSA does a tremendous job of preparing students along those lines in being really great healthcare workers. And so I would lean in on some of those things you've learned in HOSA.
Awesome. Okay, so what activities would you recommend local chapters prepare for respiratory therapy competition?
Will you repeat that question for me?
What activities would you recommend for local chapters to prepare for the respiratory therapy competition?
One of the things I think that would be really helpful, if it can be facilitated, is to try and connect with an RT school and see if there might be an opportunity for the HOSA group to either go to the school or someone from the school to come to the classroom to talk about respiratory therapy, to demonstrate some of those skills, to bring some of their equipment. I think getting some hands-on is always helpful. I would encourage you to look at those videos and get some of the stuff so that you can practice hands-on. But getting that personal connection with an RT would be helpful.
Okay, where can we find this program? Would it be a graduate school? Is there an entrance exam to be accepted into an RT program?
It varies depending on the program. I know, as you know, I'm at Middle Georgia State University. We do have a students apply to the program. We accept students to spend in our school itself or from outside, but you apply to the program here. There is, for us, we have an entrance exam. It is basic math and an essay. We look at GPA and all the different things that are out there. We also have references, but each program is going to have their own entrance criteria, and you can usually find that information on their websites. And so going to the COARC website, the Commission on Accreditation for Respiratory Care, it's going to show you all the respiratory therapy programs in the U.S. And then you'll be able to find links to their sites. And then that's a matter of exploration, is to see what do they require. And then I would work on meeting those criteria.
Awesome. The next one is it recommended to take this course if you're interested in becoming an emergency physician?
Oh, wow. I will tell you, I have known respiratory therapists. I actually, I went to school with some respiratory therapists who I have one friend who is an anesthesiologist now. He was an RT. I have another friend who works as a nurse anesthetist. Went back and just really wanted to immerse themselves in that anesthesia airway management world. I have a friend who has gone on to emergency medicine. I have another friend who is becoming a pediatrician now. And, the list goes on. So, it can be a career for a lifetime, or it can be an experience to help you build towards other professional goals. I actually think building those skills and having that critical thinking experience prepares you very much for some of those other healthcare careers like medical school, and gives you a foot up in, so to speak, in those areas, because you're building those critical care and assessment skills that some people have to learn while they're in a program. You've already got those things, and in respiratory therapists, we do that.
Awesome. Here's another one. How can we apply for a scholarship? And what types of scholarships are there?
Now that's going to vary. I know that HOSA has some respiratory therapy scholarships. I think we gave out two this past year. I want to say they might have been $1,000 a piece. But for scholarships, each school, you're going to have different scholarship opportunities that might be. I will tell you too, and this is something to consider. Right now, as I mentioned, there's a shortage of respiratory therapists regionally close to me, but also nationally. And there are scholarships out there, but also there is tuition reimbursement opportunities with healthcare providers. There are programs where there is a lot of support. Some of my recent graduates got $20,000 sign-on bonuses upon graduation. Some of them got their reimbursement for their education. And there's programs out there that also help support while you're in there. So do explore opportunities. There's a lot of opportunity for our profession.
Awesome. Sounds great. What would you say was one of the most defining moments of your career?
Wow, that is a great question. I'm gonna tell you a story, and I've been in higher education for 21 years now, but I worked for about 13 years in critical care. And my favorite area to work in was in pediatrics. And it's seeing the patient that comes in the worst situations, being able to intervene and make a difference. I had this kid come in the hospital one time in respiratory distress. He actually had considerable lung disease, and mother was dying on the other side of the hospital. He was in isolation. He was by himself. I would go in and read a book to him. And when I had a break, and he wound up getting worse. I wound up responding to a distress call. I intubated him. I placed him on a ventilator, breaking my heart the whole time. He was on the ventilator for a few days. We were able to help him get better and come off that ventilator. And then a few months later, guess who comes in to see us? He comes to visit the pediatric ICU and sits on my lap. And that's the kind of moments that make it everything you do worth it, because what you do as a respiratory therapist is about caring for others, and it's about making a difference. It is hands down, and of course I might be a little biased, but it is the best profession there is.
Okay, thank you for sharing. Overall, how many years of schooling does it take to become a respiratory therapist?
I would say overall, you're looking at a minimum of 2.5 to 3 on up, wherever you want to go up on that master's level and however you want to do it. The associate degree programs, you're going to have some core that's needed. And then usually the actual training to be a therapist is 18 months or so. And then with the baccalaureate degree, you're going to have about 2 years of core and 2 years of training. One of the things your baccalaureate degree is going to do, you're going to have, of course, more core, you're going to have more science preparation, but then you're also going to have those courses in leadership, management, education, and research that's then going to help prepare you towards those management leadership positions later on. And also if you get your associates, then you can also bridge over in a bridge program and advance your degree into a baccalaureate, and then of course a master's degree if you want to. When you get to those master's degrees, you're looking at specialized care and advancing your what you do in those specialty areas. So a lot of different opportunities and flavors, so to speak, but that minimum you're looking at probably a little over 2 years.
Okay, thank you. Here's a question regarding the actual event, and they're referring to the guidelines that they're to find a RT, respiratory therapist, and interview them about one of the topics after doing a research on the topic. They're asking, what kind of information are you looking for in the presentations about the topic, and what kind of questions should be asked to the RT?
I think that I think you should approach it from the standpoint of if wanting to learn more. All right. And so if you are thinking about being a reporter or someone that does an interview, first of all, you want to get to know your person. Tell me about yourself. Tell me about what it means to be a respiratory therapist. Tell me about why you chose respiratory therapy. You've all asked me some of these questions tonight. I think that's where you start the conversation and you learn a little bit about it. And then when you've chosen that topic that you want, tell them, listen, I've got this topic of smoking and vaping cessation. What can you share with me about that? Or why do you think that's important as a respiratory therapist? Or, asthma or the COPD, disease management. What does that mean? Most of your therapists are going to be very experienced in sharing about asthma and COPD disease management and what that means. And most of them are going to have been exposed to why it's important not to smoke and to not vape. That's one of those areas that I could sit here and I could talk for an hour about. But, lung health, it's important to respiratory therapists because we've seen patients who have gotten in bad situations because of it. So, yeah, I would start it by learning about them and then letting them tell you what's important. Of course, you have on your guidelines some specific things you're supposed to include in that. So make sure you look at your guidelines and your rubrics very carefully to make sure you get that answered.
Yes, read the guidelines, most important. Here's another question. It's from the same person, so I think it kind of goes together, but how can I apply to be an international board member actually, we'll have to get back to that. I was thinking it was your place, but how can I apply to be international board member in HOSA, and how will it help me? We'll have to answer those questions later. I don't have the answers to that. So we'll get you the answers later. So let's see, what else is there? From doing the HOSA respiratory therapy, is there anything that you can put on your resume that would pique the interest of employers?
So if you've done HOSA and respiratory therapy and pique the interest of employers, I think that number one, if you're the employer you're trying to, get a position with doesn't know what HOSA is, I'd share with them, make sure that they understand what it is. And with respiratory therapy, if you've done some of the RT competitions and you're looking to get involved in a hospital setting, certainly that's going to give you a step in. Some of the things you're working with in HOSA in developing the medical language, the things that y'all do, I think that's important to make sure they know why that you've got some skills out there, and certainly put it on your resume. what you've done. And if you've competed, share it. Gives you an opportunity to answer some questions about it.
When we shadow RT, is it required to have a current flu vaccine? I don't know if you know the answer to that or not.
That's going to vary on different clinical sites, and so that's one of those things when you go with your shadowing experience, and they have certain criteria you have to meet, and steps and clearance things you have to do. They're going to let you know. Some hospitals do require that you have that flu vaccine before going into their organization.
Okay. There's a couple other questions here. We've pretty much covered all of them. These are some kind of duplicates, and if we haven't specifically answered them, we'll go through them and we'll get you the answers. There's one last one. Will I be able to view this again as a replay and view it at any time? I believe we're going to send out the video, the recording to everyone who has registered for this, and that will probably include, it should include all the questions and answers that were covered. So that's pretty much all we have, and it's 6 o'clock, so I think we're good, right? Do you have anything else? Closing remarks, Terry?
I would just like to say thank you. Thank you to you for joining this evening. Thanks for all the questions. Those are great questions. And I wish you the best. I hope maybe we can get to meet sometime. And if there's anything I can help you do, you've got my email, and anybody I can help connect you with, let me know. But best wishes to each of you in your future healthcare careers. The future's bright.
Thank you so much for your hard work, Terry. I really appreciate all that you do. And it's
Thank you.
great to partner with you and with the association. So thank you so
Yes.
much.
We're excited. Let's do this.
Okay, we'll see you all soon. Thank you. Bye.
Bye-bye.